posteriorly if I need to, and I find this gigantic Adam's apple, I do the same thing. Can you swallow? Excellent. And then I have the C-shaped, okay? Do not take your finger and stab them in there, okay? Why? Because not only will he become apprehensive and no longer want you to do the palpations, okay, he is not going to be happy. Okay, so please be gentle when you're doing those palpations. All right? I'm going to turn him sideways, okay? So I'm going to go ahead and look for my sternocleidomastoid, mastoid, okay?
Good side.
It goes from here, coming up to here, okay? If I'm looking behind it, right here, these are my scalenes, okay? That is a bright light you have. That's your big scalenes, okay? If you're in here, you're also going to find your Erb's point. So for ladies, if you bring your shoulder blades up and you have this big notch in here, I'm going to have you do the same thing. Okay. So do this, bring your shoulder blades up, right here, okay? Same place, Erb's point. Why? Because my scalenes, relax, goes between my thoracic outlet goes between my scalenes. So this is called my Erb's point, okay? So God forbid you ever get into an issue and someone attacks you, this is a great place to go ahead and jam your thumb to get out of that situation, okay? So if I have him turn sideways, okay, we're going to go ahead and find his sternocleidomastoid. This right here is going to be my trap. In between the two is going to be my scalene. So if I stick my thumb in there, that's my Erb's point. Okay, relaxed, okay? As you turn him, find your own sternocleidomastoid, your SCM, and come right in front of it, okay? So if he's here, I'm going to come right here, okay? And I'm going to get his actual pulse, okay? That's his carotid pulse. There's another pulse, but that's in the vertebrals, okay? It's not something we can palpate at this point unless there's something tragic going on, okay? Next thing is here, my lymph nodes. We have lymph nodes in a whole bunch of areas. Lymph nodes typically come in through here, okay? They come down a little bit, and they also come in back here, okay? And then down the back of the spine, okay? His are not swollen. If you have sick, if you're cold, things along those lines, they do get inflamed. All right, so I'm going to have my occiput, so I'm going to turn him sideways. Okay, remember the bottom portion of the actual spine is my occiput. Okay, so how do I palpate? I come into this area and I palpate down and around. Okay, the next thing is going to be my superior nuchal line. So I'm going to come back here, find my bump. Okay, see that it's nice and flat. Okay, and that's my superior nuchal line. Okay, so here I am, okay? When you're looking at your actual spine, you can do it in a standing position. Some people like to actually have a person on the table with their head flexed nice and relaxed into the table. I'll show you both of them. So a lot of times when I'm doing some palpation, the most prominent bone that you're going to see is primarily going to be your C7. Okay, it sticks all the way out. If you want to start at the top, you can. I could care less, okay? Just remember that C1 and C2, you're probably not going to feel the spinous processes of those. C3, depending on how big the person is, really depends. Okay, so what I'm going to do is I'm going to tuck down on the shirt. Okay, if you don't find it, okay, because it's right here, but let's say you don't find it, just have him tilt his head forward for you, and it'll pop right out. Okay, and it's right there. Okay, so sit up straight again. See, this is my C7 spinous process. If I come to the side, those are my transverses. C6, transverses, C7, C5, C4, sorry, I'm trying not to destroy your hair. There we go. Okay, that's C5, C3 spinous process. If I'm looking for C1, I'm going to go to the side where I have my, my mastoid process on both sides. I'm going to palpate back about an inch, okay? While I'm here, what I'm going to do is I'm going to have him look right and left for me. Good. When he goes this way, the bone, which is the transverse process of C1, pops into my finger. Okay, this way again, pops right out. Okay, so that's transverse C1. We did spinous process C3, C4, C5, C6, C7. We also did transverse process of C7. So I find my C7, and I dig in on the side until I find my bone, and right there, that's where it is. Okay? Next thing we're going to go ahead and find are my traps. Okay, it was on your examination. So my first trap goes from here to here. This is my upper trap. Right here is my middle trap. And then from here to here, okay, is my lower trap. And then Erb's point we saw earlier, okay? When you turn your head, okay, you're going to find your SCM. You're going to go behind it. Those are your scalenes. You gave yourself a little bit of space and you put your thumb in there. That's where the brachial plexus sits. It's the most superficial area where you can go in and actually feel it. Okay. let's do some range of motion. Can you turn and face them, please? Okay, so we're going to do some range of motion. When you do range of motion for active, you can sit up. Okay, I don't care. All right? So as he's sitting here, I'm going to have him sit up nice and tall. Can you bring your can you bring your chin straight down? Okay, this is flexion. Okay? Does that give you pain? He says no. I want you to go ahead, and you'll notice how my hand is on his back because I do not have a chair. Okay, that's why my hand is there. But when he comes back, make sure your hand is here. Younger people and older people don't like being in extension. Okay? So my hand is here automatically. Just lean back for me as far as you can go. Awesome. Good job. Look straight ahead. Feel okay?
Yeah.
Good. Can you do me a favor? Keep looking straight ahead. Bring your ear to your shoulder. Good. Oh, clunk, clunk. All right. So that's going to go ahead and be lateral flexion to the right. Do me a favor. Go this way. Lateral flexion to the left. Probably not as much right there. What I want you to do is I want you to keep your head straight. I want you to bring your chin over your shoulder. Good. Awesome. Okay? With these motions, it really depends. Okay? When you're doing flexion, extension, and rotation, they all depend. Lots of people say that you can do rotation to you can do lateral flexion to 45. The book theoretically says 20, 35, things along those lines, okay? When you talk about rotation, they say you can go all the way up to 90. I usually say, you know what, most people aren't going to get there. I usually do 70 to 90, okay? Same thing here. Keep your chin nice and flat and come over here. Excellent. Thank you. Okay, and you're going to look to see if there's any problems with them. Okay, so for example, can he go in one direction but can't go in the other direction? Okay, making sure that you're looking at things, making sure that he's all level as he does this. Okay, my next area is going to be my passive range of motion. So passive, I'm going to have him lay down. Okay, he must trust me, okay, as the actual patient, as the actual practitioner. Okay, so go all the way down, be nice and calm. Good. Okay, so my job is to bring him into flexion. Okay, to bring him into extension, my lateral flexions, and my rotations. Okay. I'm going to show you two ways of doing it, okay? This, I'm going to do what traditional people do at a clinic, okay? And then I'm going to really show you if I'm really going against gravity, the best way I should do it, okay? So my first one's going to be my flexion, okay? Nice and relaxed for me, and I'm going to bring him up, okay? Is that uncomfortable for you? Okay, do you feel a pull down with your back? Okay, good. Other people from this aspect will keep him here because it's easier, okay? And what they do is they grab the occiput, nothing else, just the occiput. They bring the ear to the shoulder, which he has more motion. A little tight on this side, okay? And then I'm going to have him do his rotations, okay? And go from there. I will have him go onto his stomach, okay, against gravity always, okay? You can rest your forehead right there, okay? And what I'll do is I'll grab him this way, okay, and just bring him back, okay? If I wanted to do the whole thing against gravity, okay, if you really truly want to do it against gravity, which you don't have to, go ahead, be on your back again. Okay, same idea. I am here, flexion, roll on this side. Good, I'm now holding you, nice and relaxed. Take your underleg and make it straight. Yeah, there you go, you're good, okay? Drop your head, please, okay? Lateral flexion, rotation, okay? On your stomach. Okay,
You just blew Melissa's mind.
same position as before, okay? I'm holding him here, so I'm kind of like on the actual, like your temples, like where your sphenoid is. And you're gonna be here, and you're gonna bring it back, okay? On this side.
Oh, the
One leg
faux
straight,
hole
one
looks
leg
good
bent.
from the back.
Good, nice and relaxed. Drop your head as much as you can. Good. Bringing him up, bringing him into rotation. Okay? And then, of course, on your...
It looks nasty.
You okay? Okay, and then back on your back. Okay? So it's nice. As I move him, notice how I'm not like on your front, on your back, on your side, over here. Do them all together because it's going to be much easier for your patient. Okay? My next one's going to be my resistor range of motion. I like it because I have a guy, but I'm going to say this guy is like, please don't touch my boobs. Okay, so when this happens, I really have to be careful. Okay, so what I'm going to do is you can do resisted range of motion or manual muscle testing. I'll teach you both of them. So here is my hand stabilizing. I'm going to say, okay, do me a favor, push your head up. Come on, push, 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 push. Good. Resisted range of motion. Bring your head up. Hold, don't let me move you. Manual muscle test. All right? He's going to be sore by the time I'm done. All right? If I want to do the other ones, great. Bring your ear to the shoulder, okay? Manual muscle test. Hold. I'm pushing this, not the shoulder. The shoulder is my stabilizer, okay? And my hand is here, okay? Hold. Don't let me move you. Good. Relax. You can do the same thing. Resisted range of motion. Push that ear towards my shoulder. Come on. Push, 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 push. Good job. Okay? Let's do some more, okay? Rotate this chin to this shoulder. Not yet. Hang on. Good. Go ahead. Go. Go, 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 go. Okay? Some people, I do up here. Some people like to go by the jaw, but a lot of people have TMJs, and it gets really uncomfortable for them, okay? If you want, you can put your hand here as long as you're not compressing the carotid artery, okay? If you want to do manual muscle testing, come towards me. Oh, let's rotate you. There you go. Hold, don't let me move you. There we go. Okay? Same idea. All right? We'll do the other side so you guys can see it again. I'll sit. Okay? Let's do some resisted range of motion. In this position, this is typically where I am. Okay? For you, because you actually have your actual phones, I'll do it this way. Stabilizing, holding. Bring this ear to the shoulder. Come on, push, 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 push. Good. If I want to do resisted, hold, don't let me move you. Okay? Pushing this. Okay? Rotate this way. Hold, don't let me move you. Good. Relax. Hold. And what I want you to do is take your chin and bring it to your shoulder. Good. He was a little fast on that one. All right. On your stomach. Okay. If I want to do... Ooh, you're losing money. All right. If I want to do resisted range of motion, just have him bring his head back. Come on, come on, come on, come on, come on. Good. Problem with this is, I know it's uncomfortable. See my hand? I have to touch the muscle. Okay? That's the issue with this. You have to activate that muscle. Okay? If I want to do resisted, I have him bring his head back. Hold it, let me move you. Okay? So that's active, passive, resisted. Okay? You all right? Turn over. So what I'm going to have you do is I'm going to have you guys go through that, okay? Go through what you're looking at. Look at your actual palpations, okay? Look at your range of motion, whether it's active, passive, or resistive. Whoa, look at that. Do you have a headache?
No.
Not yet.
You're gonna.
Yes.